Hi, I'm Kendra Lindemann.
I'm Natalie Zuniga.
Sarai Sabatino.
I'm Karen Garola.
And I'm Inta Cedillo, and we are nursing students at the University of Incarnate Word.
Today we will be talking about type 2 diabetes in Bexar County. Most importantly, the ways to prevent it and also the ways to self-manage your diabetes. I myself will be talking about exercise.
I'm teaching ways to monitor glucose.
I will be teaching about healthy food options.
I will be demonstrating how to use the glucometer.
And I'll be teaching about complications in the diabetic patient.
We hope you enjoyed this little learning video.
Thank you. Heart disease. So 74% of people have high blood pressure. They either also have high cholesterol or high triglycerides. This makes them 2 to 3 times more likely to die of heart disease or stroke. These conditions can make it worse because they could either become cognitively impaired or become paralyzed. Kidney disease. So cells and blood vessels in the kidneys are damaged and don't allow for proper excretion of waste. If this waste is not excreted, it starts to build up in the blood, which can cause the kidneys to fail. If the kidneys start to fail, they would either need a kidney transplant or require dialysis, which is a machine eliminating waste from the bloodstream. So for nerve damage, high blood glucose levels for a long period of time can damage blood vessels that provide oxygenated blood to nerves. If these nerves are damaged, they could stop, slow down, or even send wrong messages to the nerves. Numbness, pain, and weakness occurs in arms, legs, hands, feet, digestive tract, heart, and sexual organs. This could lead to more health concerns because an undetected cut can lead to infection and even an amputation. Oral health. People with diabetes experience more problems in the gums and teeth. High blood glucose levels feeds infections that are already existing in the mouth and make them harder to treat and can worsen them. For vision, high blood glucose levels and high blood pressure cause the little veins and vessels in our eyes to swell and to leak into the retina, making vision blurry and spotting sometimes, causing blindness or diabetic retinopathy. Cataracts, which is cloudiness, and glaucoma, which is ocular nerve damage, are more likely to occur in diabetic patients.
So here are some recommendations that the CDC and the American Diabetes Association offer to monitor your blood glucose levels. So for the A1C testing, it measures your blood glucose levels over the course of 2 to 3 months, and you do not have to be fasting to take this test. So for blood glucose levels less than 5.7%, that is the recommended range. When a patient has levels between 5.7 and 6.4%, a patient is considered to be pre-diabetic and should change their lifestyle choices. So when a patient has blood glucose levels greater than 6.5%, this is considered to be diabetic in the diabetic ranges, and a change of lifestyle needs to be implemented. The recommended test is the fasting blood glucose testing. This sample is taken when you're fasting overnight, usually 8 to 12 hours before. So when a patient's glucose levels are less than 99 milligrams per deciliter, this is the recommended range. And when a patient's levels are between 100 and 125 milligrams per deciliter, this could be considered a pre-diabetic range. Okay, so when your blood glucose levels fall over 200 milligrams per deciliter, that's within the diabetic range. So the last recommendation is from the American Diabetes Association. This one, you can do it at home with the glucometer. And when it's done before a meal, glucose levels should be between 80 and 130 milligrams per deciliter. And when it's done after meals, 1 to 2 hours after, it should be less than 180. Here's track your blood glucose levels at home. You can put your goal and the results of your last reading.
This next part, I will be demonstrating how to use a glucometer at home for proper self-management using these guidelines provided by the CDC. So we're going to use a glucometer to check your blood sugar at home. And first thing, before you check your sugars, you got to ensure that the batteries are properly placed, that it turns on, that you have all your supplies. And so you're going to need your test strips, you're going to need your lancet, and then you're going to need one needle. And so before anything, you want to prep your lancet. And the way you do this one is you take off the cap, you place the needle right here, and then once you push it down, it locks. And then carefully unscrew this, and the needle is ready to go. You put the top back on, and then you set the setting on how hard you want it to prick your finger. And so right there, it's already locked in place. And then next thing is you're gonna take out one of your test strips, and then ensure that the cap closes tightly, because any moisture that can get in there can ruin the strips. You're gonna set the strip in, but not all the way. And after this, you're gonna go ahead and wash your hands with soap and water, but for timely purposes, I'm just going to use hand sanitizer. So you wanna ensure that your hands are completely dry. And when you're doing this, you also want to massage your fingers just to get the blood flowing in your hands and the fingers so you don't have a problem when you prick your finger. So now that that's all good to go, I've already locked it in place. I picked the finger I'm going to use, and usually you want to do the side of your finger. So I'm going to go ahead and use this middle finger. I'm going to prick the finger, push this in. You wipe away the first drop of blood, and then you place it on to the test strip, and you give it a couple of seconds. It'll give you a reading. And you just wait, and there you go. And then you record it, and you track your blood glucose. And then just to ensure that you properly dispose of things, using an old like detergent bottle or coffee, something that's thick, you would dispose of both the needle and the strip.
Next, we're going to talk about healthy food and diet. This information comes from a peer-reviewed article on type 2 diabetes self-management. The first tip is meal prepping. Meal prepping is a great way to regulate your diet. Easy to make foods are prepared on the weekends and then divided into containers for the week. Examples of this would include vegetable soup and/or salads. Then you can have an easy protein source prepped and ready to go, such as eggs, nuts, or cheese. Preparing snacks ahead of time also keep you from picking out unhealthy foods from a vending machine. Choose less often beef or pork, and instead choose non-fried fish or seafood as a source of protein. So up here we have our proteins, and I have an image of grilled fish. Next, all sweetened drinks can increase carbohydrate intake. So things such as soda, alcohol, or juice are more readily absorbed than sugars and whole fruits. Instead, water should be consumed and could be flavored with lemon or other fruits. And you can also start with diet soda, but the goal should be to ultimately work yourself off to water only. Diets with moderate fat intake can promote satiety and can lead to improved long-term weight management. While fats can be healthy, small portions are nutrient dense and must be monitored, or it can upset energy balance. So on here I have a couple of examples of fat sources, and those include avocados and nuts. The ADA recommends limiting refined carbohydrates such as sweets and processed foods. Carbohydrate intake should come primarily from natural sources such as whole grains, fruits, vegetables, and legumes. And on here we have an apple, and fruits and vegetables also include the potatoes. There's a common misconception that fruits and vegetables raise glucose and should be avoided. Starchy vegetables such as potatoes and fruits pack a carbohydrate punch and have significant nutritional benefits, along with fiber and vitamins.
Okay, so exercise is pretty important when it comes to diabetes. So the first thing that you're going to want to do is go to your doctor and get a pre-exercise screening, and this lets you know if you are eligible to partake in physical activities. Once you get this approval by your doctor, you can start to work out. It is important to know that you should check your blood glucose both before and after you work out, because you run the risk of lowering your blood sugar. A way that you can prepare for this is by carrying around a small snack that mainly consists of carbohydrates. The recommended amount of exercise is 30 minutes, 5 times a week. But if you're not currently working out, start smaller and maybe just do 10 minutes of aerobic exercise 5 times a week. There are 2 types of exercises that you can partake in. The first type is aerobic exercise. These are things like brisk walking, stair climbing, or moderate to heavy gardening. This helps your body better use insulin. It also betters your blood circulation, and it decreases your risk for heart failure by lowering your blood glucose and your blood pressure levels. The second type is strength training, and this is good for your body because it also lowers your blood glucose levels. Things that consist of strength training are resistant bands, and these can be used both at home and in the gym. Weights around the house, light weights, and then you can also do weights around the house like canned goods or bottled water. And then the last type is calisthenics, and this consists of like using your own body weights via push-ups or squatting.
A year ago, Clint Morrison was diagnosed with heart disease and type 2 diabetes.
I went to the doctor, and they did a blood sample, and a week later called up and said the results was I crossed the threshold to be designated as diabetic, and immediately needed to go see a dietitian and learn about how to manage it through diet and exercise versus going the more harsh methods of drugs and or insulin.
One of the problems with people with diabetes is that their blood sugar is too high. So when they exercise, it actually helps to lower the amount of sugar that's in their blood. So we always tell our patients that along with diet, we want them exercising because it's going to help them to get better management of their diabetes.
Until last year, Morrison's workout routine consisted of rigorous backpacking trips 4 to 5 times a year. So exercise physiologist Sean Morgan taught him how to be safe when exercising.
Yeah, the exercise became a lot more focused in terms of being monitored with my heart rate, as well as to have my blood pressure checked periodically during the stages of workout, and the blood sugar reading was checked before and after. And so all of that became a very fine-tuned feedback system for me to see how, one, my blood sugar was being controlled, as well as the increase in the strength of my heart.
We really want to make sure that before we're doing any type of exercise that we are checking our blood sugars, because sometimes with exercise it can make our blood sugars go up too high, and it can make it go, of course, too low.
Diabetics always need to check their blood sugar levels before and after exercising, as well as during the routine if it's more than 45 minutes, according to the National Institutes of Health. Blood sugar levels lower than 100 milligrams per deciliter may be too low to exercise safely. Having a snack like fruit or crackers can help bring the levels up. Levels higher than 300 are not safe for exercise either. The ideal blood sugar range for a safe workout for most diabetics is 100 to 250 milligrams per deciliter.
I think, again, that we need to start off slow. I think it's important to do something that you like, and just getting out there and doing that every day and trying to do something every day. And that just may be a 5 or 10 minutes, but the key is to keep moving, because that is going to help with the management of your diabetes.
Clint's diagnosis has given him a new perspective.
Never take for granted if you're ill. Don't just think it's a cold and you're going to get over it. Go to the doctor and get checked out. I was quite amazed at how everything I've learned since I was diagnosed about diet and exercise and how it affects the body. Oh, I feel great, 1,000% better than I felt. I was scraping the bottom, and it's all great now.
Holly Furfer, CNN.
Thank you for watching and participating in our presentation. Stay tuned for a Kahoot game to test your knowledge.
Thank you.
Bye.